Hello, everyone. It's 7 o'clock, so we're going to get started. And welcome. Thank you, Nancy Schwartz, for coming back to get us caught up on the inevitable changes to Medicare. I'm going to ask you to just stay muted during the talk, but please feel free to put your questions in the chat, and we'll either address them if they're the topic we're talking about, or we can address them at the end. And if you are not in speaker view, on the upper right hand side, go to view and click on that and get into speaker view so that you can see Nancy's screen fully. And Nancy will have a handout that I'll be emailing you, and Nancy will tell you a little bit more about that. Meanwhile, Nancy, all yours.
Okay, Joanne, well, thanks so much. And hi, everyone. It's really a pleasure to be here with you tonight. I recognize some of your names and others of you. It's great to meet you for the first time. It's a pleasure for me to share my expertise in Medicare with you. This is really a time of year when Medicare becomes top of mind for so many people, because you're going to start seeing, if you haven't already, countless ads, TV ads, get a lot of mailings. You may be getting calls, although you're not on the do not call list, about Medicare and changing your plan. So I want to tell you about what to do about that, if anything. As Joanne said, glad to answer your questions here or at any time. Here's how you can reach me if you have questions later on. And this information is going to be on the handout, the worksheet that you received from Joanne as well. So don't worry about noting that down. I'm a Maplewood resident. I'm licensed in New Jersey and a bunch of other states. And I'm what's called, just so you know, an independent Medicare broker. So folks who are independent brokers, all that means is we don't work for one insurance companies. We represent multiple companies. And this is the type of person, if you find a guide to Medicare, you want to get an independent broker who can match you with the right plan, no matter what company it comes from. For independent brokers or any insurance broker, there shouldn't be any time a fee for their services. The premium you pay, every insurance premium, includes a commission. You pay the same premium whether you enroll directly through the company or you use a guide like a Medicare broker. But when you enroll through the company, they keep the commission. And when you use a guide at no cost to you, they're compensated by that commission. So the problem that I really want to talk with you about today is this. That time and time again, I hear from folks who have lost access to the doctors they love, and sometimes are overpaying for healthcare and medications by sort of randomly choosing, because they didn't know any better, or simply renewing the Medicare Supplement, Advantage, or drug plans that you already have. So this happens for a bunch of reasons. And if you take this route, and it's very hard to get clear information about Medicare, how it works, and how what each of the plans have to offer you. So no criticism for you. I work with so many smart people who are mystified by Medicare, as I was before I shepherded my dad through the end of his life. That was him in the intro slide. And I was forced to learn a lot about Medicare. That's what inspired me to move into this field. So today I'm going to share with you a strategy, something that I know you can do. I'm going to get down into the hands-on to learn what coverage you really need and want, to assess if you're already on Medicare, the plan that you have versus strong alternatives, to see what you're paying for costs for your coverage and how the benefits, are they the same or are they different? Oops.
That was
Sorry.
my mistake. Sorry, Nancy.
Okay, it's happened before, but anyway, so by the end of this webinar, perhaps when you get the handout from Joanne tomorrow morning and you have a chance to digest it, I'm going to transfer to you the knowledge of how to assess your healthcare needs and wants, match it with the available plans that are out there, and enroll yourself or have a Medicare broker enroll you in the right plan, the best fit plan for you. Okay. I was astounded last year when I saw this research finding from the Kaiser Family Foundation. They're an incredible foundation, do a lot of healthcare research. And what they reported on was that 70% of Medicare, of folks on Medicare, don't look at plans, don't look at alternatives, don't even take a deeper look at their own plan during what we're about to come up to. They use the language open enrollment period. It's really called annual enrollment period. And so I wondered, I read this article and I began to wonder what's getting in people's way. I mean, what is preventing people from doing the due diligence they do in every other aspect of their personal business? And so as I spoke to people, I did a lot of interviewing on this. These are some of the reasons I found. And these are reasons that deter people from doing a deep search for the right first-time Medicare plans, as well as for renewing their plans. So you see, some of the things, it's too time consuming. I don't know what I'm doing. I have no idea what the part is and the plan and what do I need. So these are just a few of the deterrents, the barriers that get in people's way. The thing is, it's just human nature to shy away from what makes us uncomfortable. And every single one of these reasons makes us feel uncomfortable. So that's why I realized that a 3-step doable strategy that will be reviewed in the handout is the way to break down these barriers and enable you to be matched with the right Medicare plan. Now I'm going to show you how. Well, in a sec. I don't know if any of you have this year round, those of you already on Medicare began to receive that kind of mail, seen ads on cable. You see a lot of Joe Namath, I hear. We don't have cable. JJ Walker, I don't know when he became an expert on Medicare. Few other folks. But it's going to start October 1st. It's going to be an explosion. And it's overwhelming. And you may even be getting phone calls, even though you're in the do not call list. Those are illegal, hard to do anything about it. But all this stuff is overwhelming. And there are a lot of people, mostly big call centers, that break the rules. Rule number 1, you're not supposed to do anything, communicate on 2023 plans until October 1st. But here is an email that I got from a current client back in August when she got an email solicitation for finding, they call it 2022 open enrollment, for finding actually a 2023 plan. So you'll run into all this stuff, and you're going to become a very sharp consumer and learn how to basically throw away all the stuff that comes directly from insurance companies, because that's not how you want to shop. Learn what's really important. The first step I find is really, it's important to review with you the parts and plans of Medicare. So there are 5 of them. Any individual doesn't have all of them, but I am going to briefly show you how they work together. So the first components I want to talk about are at left, Part A and Part B. And those are the Medicare from the federal government. Okay. Part A covers, and we call the Medicare that comes from the federal government original or traditional Medicare. Part A covers hospital room and board. That's it. When you're admitted overnight. And all your medical costs, the list you see here, are covered by Part B, whether you get those treatments and visits in the doctor's office, a hospital, a clinic, or an infusion center. So those are the 2, sort of the foundation of Medicare. The problem with that is that there's significant costs on the part of the individual when you have just original Medicare. On the left, your costs with Part A for hospital room and board, your costs are highlighted in yellow. And for Part B, your costs are highlighted in red. So there's a lot of financial vulnerability if you have just original Medicare from the federal government. You're going to incur a lot of medical costs. As we know, the cost of visiting, let's say, a dermatologist is sky high. Doesn't matter how much you need that visit, but 20% of that is very significant. And then in most states, 42 states in the US, including New Jersey, medical practitioners can charge up to 15% on top of the Medicare reimbursement rate. And that really bridges the gap between private insurance and what Medicare reimburses them at. So you can see there's a lot of financial responsibility left to you. Even if you're the healthiest person in the world, we buy insurance not generally because of where we are today, but what might happen in the future. And so, everyone hears so much about different kinds of health events, catastrophic or just something like the shoulder surgery that I'm recovering from. I mean, I thank God for insurance. These things really add up. So the part that, this is a very big problem, and there have been 2 solutions developed to fill the gap. Okay. On the left here is approach A, and that's Medicare Supplement, which isn't a part. It's doesn't have a letter, although there are different kinds of Medicare supplements offered, and each package of benefits and coverage is called a plan. Plan G is the most common right now, the most comprehensive. With a Medicare supplement in combination with original Medicare, you have comprehensive coverage on the medical side. And then you also need a drug plan. So you get a standalone drug plan. That's called Part D. So if you take the supplement and drug plan route, you have Part A from the government, hospital room and board, Part B from the government, medical costs, and then the Medicare supplement, it works together with original Medicare. And then the drug plan, also known as Part D, although you get it through a private insurance company. And please, I wish I knew why, but I don't. This is what really confuses people on Medicare, stuff like this. The other approach is Medicare Advantage plans, and that's what you're going to really see the most of and hear the most of in marketing that's coming up in the annual enrollment period, because that's more profitable for the insurance companies. So I don't want to get deeply into it, but I want you to understand the parts and the different options you have. With Medicare Advantage, if you enroll in that, the government agency in charge of Medicare, CMS, hands over management of your Medicare to the insurance company. It's completely privatized. They pay the insurance company a per head fee, and then they set their own deductibles and copays, and it's really a pay-as-you-go kind of thing. Okay, so we've talked about Part A and Part B from the government. Part D is a drug plan. If you go the Advantage route, by the way, that's built into that plan. Part C, that's another name for or a way of calling Advantage plans, or those are from the government, and then Medigap or Medicare Supplement. Okay. The reason I have question marks in the Part D drug plan column is that that's where a lot of the changes, that's where all of the changes in the recently passed Inflation Reduction Act lie. They're all in the prescription drug plan. And those changes they're going to be, as you see here, they're going to be layered in year by year. The aim is to reduce the cost on the part of the Medicare beneficiary, that's you, and also to increase Medicare's ability to negotiate with pharmaceutical companies, which was illegal for them to do until starting in 2023. So the great things that are going to happen in 2023 are this. There's a cap on drug price increases. And if that rate of increase exceeds the inflation rate, then the pharmaceutical company has to pay a fine to the federal government. So that should be a disincentive. Insulin costs will be capped at $35 per month. So that is a fantastic change, important change, because so many Americans are plagued by diabetes. And finally, in 2023, all adult vaccines will be available to you as a Medicare beneficiary at no cost. That hasn't been the case in the past, and more vaccines are covered. For example, the more effective shingles vaccine, called Shingrix, will now be covered in full and at no cost. So you can see here that these changes will be feathered in throughout the years, and they're really going to make the drug plans much more, decrease your financial vulnerability when it comes to the drug plan component of your Medicare coverage. It's been pretty significant. Okay, so I want to go back to our core problem now. That's the context. I want to go back to the core problem and share these 3 steps I recommend you take to identify the right plans for you. The first thing to remember is you have just one opportunity per year. That's a limited opportunity. And that is coming right up. It's the annual enrollment period. from October 15th through December 7th, you have that opportunity each year to change your Advantage or drug plan for 2023. This is the time of year, if there's any time of year when Medicare is top of mind, this is the time of year. So if you have if you're taking the supplement plus drug plan approach, I suggest you use this time when Medicare's on your mind to assess your your supplement plan as well. So what is annual enrollment period? Well, you may have already received something called an annual notice of change from the insurers behind your Medicare plans. You're supposed to receive that by the end of September. Okay, that is supposed to alert you that there will be changes in your plan. So I'm going to discuss the kinds of changes that may be made. A lot of them are going to be detailed on page 6 in tiny print. So at least by knowing the type of changes that are generally made, you'll know what to look for and you'll look hard. So this is the timetable. You get your annual notice of change letter sometime in September. On October 1st, the new or the updated Medicare Advantage and Part D drug plans for 2023 are released. And so however you want to work, either I'm going to tell you a little bit more about how to find out what plans are out there. You're allowed to make changes to your Part D or Medicare Advantage plan anytime between October 15th and December 7th. As I mentioned, take this opportunity if you go the supplement route to review your supplement as well. That can be replaced as well. And these changes for the Advantage and drug plans go into effect January 1st of 2023. This is what a typical annual notice of change looks like. Okay. The important thing for you to remember, or really a way to think about this, is that this time of year, it's time for your annual Medicare plan checkup. It's the only way to know if you have the right plan and to avoid being surprised by things that are no longer covered, doctors no longer on your plan, or huge price increases. Okay, so you have to do it within the right time. Otherwise, you risk this. Of course, paying too much. That's nothing anyone wants to do. So in your annual notice of change, you'll see things like this. Most of them haven't gone out yet for comparing 2022 and 2023, but you see that they're changing the way they're charging you for out-of-network physician copays. So make sure when if you have an Advantage plan, you're going to get something like this. Advantage plans are really complicated, and that's also a deterrent to making a change. It's really overwhelming, and honestly, most people would rather be doing something else. So I recommend you really go through that line by line. Also for your drug plan, if you have a supplement and standalone drug plan. On the Medicare supplement side, look at your current premium and then look back to what you were paying last year and the year before. Most people don't know it, but if you hold on to a supplement plan, much like your homeowner's insurance or your car insurance, the longer you hold on to a single policy, most people don't know that they may be able to change their supplements, the more of a loyalty add-on fee you pay. That's the opposite of what you would think, right? Loyal customers get a discount. Well, that's not how it works in insurance. They know, or they suspect, you haven't left that plan for a while and they think you're not going to. So they continue to make money on you by raising your rates more and more over time. So in terms of changing a Medicare supplement, I do a lot of review of that, with my clients. You want to look at this every 2 years, I'd say, at a minimum. And what you're looking for is generally the same coverage at a lower premium. Let me note that in most states, if you want to change your Medicare supplement, you have to pass what's called underwriting, or a look back at health history. But don't take yourself out of this process because you think you're not going to make it. Really, there are just a few. Most people do pass medical underwriting. So always ask an expert before erasing that opportunity for yourself. The second risk you face in not evaluating your plans is that you may lose access to your favorite doctors, hospitals, or pharmacies. So in an Advantage plan, for example, your plan's network of medical practitioners changes all the time, even during the course of the year. So if you have an Advantage plan, make sure that your favorites, and that might not, if you see a lot of doctors, it can be hard to, if you have 10 doctors, to find a plan in which all of them participate, but pick your favorites, and you want to make sure they're covered by your plan. They're part of your plan's network. Remember that even with what's called a PPO Advantage plan, it's not a true PPO as in pre-Medicare insurance where you can basically see any doctor. There are complications here. And if you see an out-of-network provider, your plan may not cover your costs. On the drug plan side, they may no longer work with your preferred pharmacy. Some people have a close relationship with a pharmacist who really knows their situation and perhaps streamlines the process of getting their medication. So you want to make sure that your preferred docs, hospitals, and pharmacies are in your network. The docs and hospitals, that's for an Advantage plan, and the pharmacies, that's relevant for a standalone drug plan or an Advantage plan. The other risk you face through not doing a thorough annual Medicare plan checkup is that you may find that your medications either are not covered, they require prior authorization to fill every time, which is a real pain, people tell me, or that there are limits on the quantity you can get each month. So every insurance plan, pre-Medicare and Medicare, has a list of covered drugs, and that is called a formulary. So even if your drug is still covered, you want to look at that. You want to look at if your drugs are still covered in 2023 and what your copay is going to be. And this, you want to look at whether you have a standalone drug plan with a supplement or a drug plan that is part of an all-in-one Advantage plan. The pharmaceutical companies are changing these costs all the time. Okay. And, as I said, with the new changes for Part D, the drug plans with the Inflation Reduction Act, you're going to be protected more and more over time. But, you have to advocate for yourself. And so, of course, building this knowledge and skill is a key component of self-advocacy. Oops. So that's what you risk if you don't do your annual Medicare plan checkup. So here are the 3 steps for doing that checkup. They're going to lead you to the plan that's best for you. The first thing, and this is something we never think of if we've had, employer health care, is figure out what you really need and what you really want, 2 different things perhaps, in terms of your Medicare plan. I suggest that, and this is relevant for those who are going to be new to Medicare as well as those already on Medicare. A great way to start, and I have all the steps for this on the handout, by the way, is to inventory your healthcare usage last year or 2022 to date for the first 3 quarters. So this will help you get a very clear sense of how many physicians visits you make. Typically, you'll know if it's an atypical year. How many are to your primary doctor versus specialist? That matters for an Advantage plan. What about your medications? Are there certain treatments or procedures that you're going to go through in 2023? And how, what are those? This is going to give you the parameters of what you're looking for. And so that's your needs. And then the second thing I want you to consider is your preferences or your wants. And this is important too. So here's on the questionnaire that I ask my clients to complete before we have our first in-depth meeting, I have a question. I ask them, what pharmacy do you prefer? And I ask them, would you pay more to use it? That's because some people, as I mentioned before, are really loyal to a particular pharmacy. Typically, if they are, it's an independent pharmacy. And so some people are willing to pay more, but you need to figure that out for yourself. Ask yourself, how much is that worth to you? Do drug pre-authorizations drive you crazy? It can be. With Medicare drug plans, the pharmacy needs to ask the doctor for that each and every time you fill a prescription. That can be a real pain and delay the processing of your prescription. Another thing, of course, do you have specific doctors you want to use? And a very important consideration is lifestyle. This is really a key component in deciding whether to go with an Advantage plan versus a supplement plus a drug plan too. Do you get most of your health care in one location? Or do you travel frequently in the US or have a winter home or grandkids or something else that lead you to another location where you stay quite a while? There are just a few Advantage plans that offer that kind of flexibility and usage out of your home state and sometimes area, county within the state. All supplements do. You can use them all over the US. And finally, a really important issue as our hospital structure continues to change with all these roll-ups is there one ER hospital you have most faith in? That's a really important thing to research if you don't have an opinion yet. I know in our area, things have changed. There used to be one place, no questions asked, you go there, and now that's changed. Okay, so those are your wants. I encourage you to write all this down, your inventory of healthcare usage and your healthcare preferences. I find, with my clients and in my previous work in many years ago in the communications field, but that by writing things down, it makes them more real. And it's going to enable you to hold yourself to a higher standard in terms of putting in the time and effort to make this kind of review happen. Okay. After you have that work done, of course, you're probably going to have a lot of needs and wants. So as the saying goes, you can't have everything. And if you try, you're going to end up with less than you could. So what I urge you to do with your healthcare needs and wants is to prioritize them and to make a list of the top 2 or 3 elements that matter most to you in your healthcare. That is solely individual. And this is one reason, in addition to your needs and wants, why you never want to take Medicare plan selection advice from a friend or a family member, because what's right for you is going to be very different from what's right for them. When you've prioritized your healthcare needs and wants, it's time to match your priorities with available plans. So I'm going to go ahead and say that you're going to have your list of what you're looking for, the top level on hand, the top level priorities, as well as more the detail of the number of doctor's visits you anticipate and so forth. Let me make a point that we can only do our best in estimating what our healthcare is going to be moving forward. So, estimate as precisely as you can. And here's how you're going to match your priorities with available plans. Here are some of the key questions that you're going to ask yourself. For an Advantage plan, does the network cover the doctors and the hospitals you prefer? How about your pharmacy? Do you need a referral from your primary to see a specialist? That is frequently a delay, represents a significant delay in time. And how much, this is another key question. What is the cap on the out-of-pocket you pay with your Medicare Advantage plan? There is always a cap of multiple thousands of dollars, but there is a cap. On the drug plan, are your core prescriptions covered? That's a must. Sometimes there's prescriptions that are not covered by any drug plan or covered at a really huge price. And so in that case, I recommend that you go back and you ask your physician if there's any substitute that they would recommend. If not, or you have to test it out, try testing, or there's one that you have to test out, try testing that out now before you have to make any decision on that. And if not, you just have to choose your drug plan in terms of the lowest cost for that drug. When reviewing your supplement versus alternative supplements, you want to make sure that you have at least the same level of coverage that you have now. And, you want to look at supplements are standardized. So a plan F, and again, a plan is a package of benefits and coverage. A plan G is the same exact insurance plan, whether you get it from United Healthcare or Aetna. It's the same thing. So you look at premiums, and that's a key way that you select the right supplement. And remember, always try to change it if you can save. You won't, you'll be turned down if your medical conditions don't make that possible. But don't take yourself out of it without giving it a try. There are 2 ways to look at possible alternative plans for yourself. And you can do either or together. Medicare.gov, which is the federal government site, has a plan finder at this URL. And Joanne, you know what? I'm going to send you the URL after tonight's webinar so that you can include that in the follow-up email as well. So using this tool, you can plug in your zip code, you plug in what plan types you're looking at, and they give you some at least basic information so you can see on the available plans of the type you're looking for. So at least you can have a general idea if your current plan is okay, if you're way overpaying, or if your plan doesn't meet your needs at all. The other option is to work with a Medicare broker or guide like me. And there's another option, which is every state has something called SHIP. That's the acronym. Honestly, other than starting with senior health, I'm not sure what the other letters stand for, but that is a volunteer organization. And these folks are counselors who can help you make Medicare plan decisions. Just keep in mind that the volunteers are just that, volunteers, so they have a limited amount of expertise. Once you've matched yourself with the best plan, you want to enroll in your best fit plan before December 7th. I can't tell you how many calls I get from people like midnight on the 6th or even on the 8th. Don't put yourself up against that kind of pressure. Get it done. And you're getting a jump on it by participating with me here tonight. So that's great. So again, here's the problem. People lose access to preferred doctors and overpay for healthcare and medications by randomly choosing, let me say, or taking the suggestion of a friend or family member, or just renewing your supplement, advantage, or drug plans without knowing what coverage you need and want, realizing that some really considerable and costly changes may well have been made to your existing plan, and assessing other alternatives out there. So your solution, again, really don't listen to anyone else. Only you know all the elements that have to go into your decision. So highly individualized. So do that annual Medicare plan checkup. Look hard at what you have right now. Look at that annual notice of change that's going to come in for your advantage or your drug plan. Go through that exercise of inventorying your healthcare usage, either last year or this year to date, and articulate, what do you want? What are your preferences as well? Prioritize those elements so you know what is most important to you in your search, and then match your priorities to the best plan. So that is your 3 steps to finding the right Medicare plan for 2023. Glad to answer any questions now, or if you want to follow up with me at another time. So Joanne, I'm going to move it over to you.
Okay, hi Nancy. There's nothing in the chat, but I do have a couple of questions.
Okay, great.
So I have this little booklet that came from AARP. And one of the things in here says that if you worked over the years, you've already funded a portion of your coverage through the payroll taxes you and your employer have paid. Can you explain that?
Sure. So if you remember, sort of back towards the beginning of tonight's session, when we were talking about the Medicare from the government and Part A, hospital, room and board, and Part B, medical, if you have worked and paid FICA taxes, and that's the type of tax you just mentioned, Joanne, which if you work with an accountant, I'm sure you did, for 40 work quarters, that's 10 years. It can be broken up in any way over the course of your life. Then you have already paid the premium for Part A for the duration. So that's what they're referring to.
Ah, excellent. Now, and do most Medicare plans require for x-rays or other procedures, do they require like a pre-authorization process?
So that's a great question. Of course, the answer is it depends. So Advantage plans typically do require referrals for everything. I mean, it's an HMO model. So you have to go through your primary care physician first. With a supplement, the great thing with a supplement plus drug plan, that approach, is that there is no insurance company. It's the only time in our lives where we have the opportunity to get the medical treatment that physicians really want us to have without an insurance company saying yes or no. So no referrals are required there.
Okay. And when you're choosing a plan, you can see, or do they, most of them cover physical therapy?
Yes, physical therapy is typically covered. If you go the route of original Medicare A and B plus a supplement and standalone drug plan, that's covered as a medical cost. And it's also covered in all Advantage plans. It's a basic healthcare thing. Although on Advantage plans, there, of course, there's a copay per session, and there's typically a limit, just as in pre-Medicare insurance, in how many sessions you're going to have. And that too requires a referral or prior authorization.
Yes. Does anybody want to unmute and ask Nancy a question? Feel free, or you can put it in the chat.
I have a question.
Great.
My name is Gilda, and I wanted to ask you if, Nancy, if you can advise someone who lives in another state. I have a friend who lives in Florida. Would you be able to help her with her choice of her Medicare plans?
Yes, Gilda. I'm licensed in 14 states, including Florida.
Okay, good, thank you.
So that's a great question, Gilda. I want to sort of expand on that a little. Medicare brokers, like other type of insurance brokers, they have state level licenses. So there's always a home state. So mine's New Jersey. And then, I've expanded. I used to live in Manhattan. So I have, of course, a lot of clients over there, but also in other states, a lot of referrals and so on. So it's a good question to ask. Don't assume just because someone you hear about is based in Massachusetts or California that they don't work beyond their home state.
Okay. So if she wants to proceed, she can call you?
Sure, you can send an email introducing us. Either
Okay.
way is fine.
Okay, thank you.
Sure. Now you have me all to yourselves, and I know that you have questions about Medicare. So ask me. I'd love to answer questions. It's really a fun part of my work.
This is Mary Chevette. I have a question, but I don't know how to raise my hand here. So sorry. Could I go ahead and ask?
Sure, please do.
Okay. I thought I read somewhere under the Inflation Reduction Act that there was a $2,000 cap put on how much we had to pay for out-of-pocket drug costs. Is that correct?
That is correct. I have to look at my cheat sheet here to see what year that is. However, that doesn't come in till I believe it's 2024. Yes, it's actually 2025. So what, I'm sorry, Mary? you said?
Yes,
Yeah,
yes,
so what
sorry, I'm not
Mary
doing it.
is referring to is at this point, and why these changes in the bill, the Inflation Reduction Act that's just passed, why they're so important, is that there's been people, drug plans under Medicare, there's a lot of the financial burden left on the individual on Medicare. And the reason this is that until now, Medicare itself as an entity has not been allowed to negotiate with pharmaceutical companies. So versus, let's say, the VA, if you know anyone who gets their medications through the VA, they're super inexpensive because they negotiate with pharmaceutical companies, as this massive national network. They have a lot of buying power. Now Medicare is going to be able to do the same thing. But at this point, there really is ultimately no cap on how much you have to spend out of pocket on your medications. What Mary refers to, and this is, I'd say, the most important change, is that in 2025, there's going to be a cap on out-of-pocket costs for medications of $2,000. So that is, even if you have just a sinus infection or a passing illness, you know how much medications cost, and they typically have been much more expensive for those on Medicare than they are on pre-Medicare insurance. And now, they're going to be caps. So, especially for people who have a chronic illness or who have faced a significant medical event, this is really life-changing. So, and some of the other, let me again look at my tiny cheat sheet here. That's really, those are the most important things that are going to change, really in our favor.
Could I just ask a follow-up to that? I don't know if
Sure.
you still, Mary, I don't know if you'll even have the answer to this, but
Okay.
why are they making us wait 3 years for that?
I don't know. Now, what I do know is that, well, like many Medicare, huge organizations, Medicare takes a long time to change. Yeah, but I don't really know. It's a great question, and I'm going to research that tomorrow.
Oh, thank you.
Yeah,
Thanks a lot.
I wish, because believe me, I have so many people who have heard that, and it's, the rare good news we get in terms of Medicare, and who, are that benefit that you talked about, that improvement is really, having a cap, a ceiling to what you may pay out of pocket is so important. And yeah, I don't know why the wait.
All right,
Great
thank
question.
you.
Is there anybody else?
Hi, I have a question.
Great.
Hi, this is Kenya Brome.
Hi, Kenya.
Hi, my father is in a skilled nursing facility right
Mhm.
now, and he's going to be coming home the beginning of October. That's the end of the 100 days. Do you have any tips and information on what to expect when he comes home? What types of things will they send him home with? Physical therapy, home care, beds?
Typically, the Part B medical stuff does pay for some very limited home care when someone comes home. Now, is he on, does he have an Advantage plan, do you know?
We used to have an Advantage plan and they stopped paying in the facility. So we hopscotched around and got a supplement. So now he's got A, B plus a supplement.
And you have a drug plan, I'm sure, too.
Now, yes.
Okay, so, well, that was a good move, because your experience there just FYI, Advantage plans don't like to send people to inpatient rehab or skilled
right.
nursing after hospitalization.
That's
I
right.
don't know the answer to that. I'm sorry, I don't want to budget for you.
Okay.
But
Okay.
there
but
are some limited.
He's entitled to physical therapy, home care. You said you don't know anything about that?
I don't really know
Okay.
after 100 days in a facility. I know
Okay.
what happens if you come right home, but I don't know after that 100 days.
I see. Okay.
I think it should be, yeah, I don't really know. When something happens at home,
Mhm.
it goes into, I'm going to ask you to follow up with me and I'm going to look that up. That's just an unusual situation. I want to be able to answer you correctly.
Okay.
So
But just as a tip, the Advantage plan, yes, they decide when they want to stop paying for your care. Whereas with the supplement, they go by the doctor's recommendation. And yeah, you could be surprised and thrown out of your facility when you have an Advantage plan because it's on their whim, not on what you actually need.
yeah, and I want to emphasize because there's a lot of confusion about this. When Kenya's talking about her dad is in a skilled nursing facility, that is following a hospitalization.
Yes.
That's when Medicare pays for that. Long-term care in any kind of assisted living or a skilled nursing home, that is not covered by Medicare.
Okay. Thank you.
Any other questions? We still have a bit of time. Well, okay. Well, as I mentioned, Joanne's going to follow up in the morning with a note and also the handout that's going to outline it serves as a checklist for you on how to do your annual Medicare plan checkup. So Mary and Kenya, I'm going to look up the answers to your questions and please follow up with me so that I can share the correct information with you. And lastly, before I turn it back over to Joanne, I want to thank you so much for joining tonight and for your great questions, because honestly, when you ask questions, you're not the only one who wants to know that. So thanks for really enriching the conversation tonight.
Thank you.
Thank you everyone for coming. And Nancy, thank you again. And the changes that are coming up in 2024, 2025, hopefully we will have Nancy to walk us through them.
You bet. I'm here.
So with that, we will say good night to everyone.
Thank you.
Good night.
Thank you. Good night.
Thank you.